Did you know a national leader in care for children with cleft lips and palates is right here in West Michigan? I'm talking about the pediatric plastic and craniofacial surgery program at Helen DeVos Children's Hospital, which provides services for children and adolescents with cosmetic and reconstructive surgical needs. Division Chief Dr. Robert Mann is here to tell us more. Good morning to you.
Thank you very much.
Absolutely. Thanks for coming in on this rainy Monday. First of all, we need to back up and start off by saying what are cleft lips and cleft palates?
Well, cleft lip and palate is the most common facial birth defect that we have. It occurs worldwide, 1 in 500 children. It occurs everywhere, not just in other countries. It occurs in the United States in that same ratio. It affects the face in so many ways. It's not just the lip that you see on so many of the charitable mission organizations where it shows a child with a cleft lip. It affects the palate, it affects the roof of the mouth, it affects every function of the face except for vision, smell, hearing, taste. But most importantly, it affects how you look, which the function of the face is to appear normal so you can interact in society and not have terrible society issues.
Yeah.
But most importantly, the palate cleft affects your ability to talk. So adults and children, if their palate is not repaired well, can't talk. And there's huge effects that people don't understand relative to these charitable organizations. It's just so a child, and they think, well, one surgery, it's all fixed. It has great ramifications as the children get older. You can imagine when the children become 5, if suddenly they can't talk and go to school, or they're talking poorly, they can get teased.
Right.
If they become a 6 or 7 and now their teeth are coming in crooked and they're cross bites, and then when they hit adolescence and the facial growth gets even more disturbing, that is a real problem for these kids.
And how does your program stand out over all the others?
Well, about 30 years ago, we looked at the differences in these children. There's a wide variety of anatomy that occurs with these children. So most programs across the country use a single pattern. That works great if it lines up with the anatomy. That was just wonderful. But there's so many types of anatomy. We decided 30 years ago we want to customize how we fix these kids. Each surgical pattern is designed for each child. Of course, that meant that we had to come up with some innovative ways to create new patterns.
Sure. Talk about those a little bit.
Well, I think the best way to understand it is how we teach it to our young doctors. If you have a cleft, think of it as a wound where you're missing tissue. If you're missing just a little bit of tissue here in the middle part of your elbow, you can just suture it together and it's not going to affect much.
Sure.
If you have a big defect from here to here and you sew it together, suddenly it doesn't work very well.
Right.
And that's the same thing with a cleft. If you have just a very narrow cleft, there's enough tissue to bring it together. So most of these patterns across the country where they're just drawing things together work pretty well in small ones. But when you get bigger ones, it starts to create more and more deformity. On an elbow, you'd add tissue, so now it works.
Sure.
Same thing in a cleft. If you have a bigger deformity, add tissue to make up the deficit. So we design surgeries where you use the inner aspect of the cheek, kind of where you bite your cheek sometimes.
Okay.
That easily goes into the cleft where you need it to fill gaps, and it has huge effects.
And we were getting a look at some of the pictures of the before and afters of some of these children. It's remarkable what you guys have been able to do for some of these kids.
Well, the thing that we can do with these is by adding tissue, it changes these effects that I described earlier. You can imagine that your speech, our results now, we don't expect just understandable speech with some of the nasality that people have always expected with cleft children. We expect perfect speech for these kids. Our orthodontics, where a lot of programs will use pre-surgical orthodontia, big appliances in babies for weeks at a time, we don't use that. And when they get to be 7 or 8, our orthodontic needs are much simpler, which means they can have their local orthodontist, either in the Upper Peninsula or outstate in other states, do the care, and it really reduces the travel. Also, other programs when kids reach adolescence may have as much as 50% of the kids needing extensive jaw surgeries. Ours is about 10 or 11%, so much, much less. So it has huge impacts for the kids.
So I can imagine that you have some places around the world that are trying to mimic a little bit about what you guys are doing there to make this so successful.
Well, because it's taken so long, we had to wait, literally you have to wait a generation to make sure that all these things are in fact doing these improvements like we've said. That now, yeah, a lot of programs and other countries are looking and saying, how can we help our kids? And that's really, really been great, because my partners, Dr. Gerardo and Dr. Polly and myself, now do a lot of teaching around the country and around the world, trying to share what we've learned over the last 30 years, and it's tremendously exciting.
Great work. Keep it up. Thanks so much for stopping by.
Thank you very much.
I want to throw some information out there for people at home. The Oral Cleft Clinic at Helen DeVos Children's Outpatient Center is located at 330 Barclay Street Northeast, Suite 203 in Grand Rapids. Give them a call at 616-391-2320. HelenDeVosChildren's.org/oral cleft program is where you can find them online. And pediatric plastic and craniofacial surgery is located at 426 Michigan Street Northeast, Suite 304 in Grand Rapids. Also find them online at HelenDeVosChildren's.org/plastic surgery. And